Hi, Dr. Chen. Today we're going to be talking about drains. Drains are typically placed in surgical fields that involve large dissection fields so that raw areas draining fluid will not result in a seroma, which is a large fluid accumulation. And the common question is, are drains always placed at the time of the surgery? And I think what most patients fail to realize is that breast implant placement surgery is probably the only breast surgery where that amount of dissection is not associated with drain placement. That's usually the exception, and the only reason why that exception exists is because we fear, as plastic surgeons, outside germs traveling along the drains and getting the underlying implants infected. So most breast surgeries of this magnitude always require breast drains. Drains typically stay in until the output falls, at least in my practice, below 30 cc's for each drain per day. Most of my patients reach that amount by day 5 or so, although about 25% of the patients get there as early as day 2. And about 10% of the people, the drains do linger till about a week out. And for that reason, I usually ask my out-of-town patients to stay in town until the drains are ready to come out. So they usually stay about a week after the surgery. So this is a recently removed drain. So typically a drain is a hollow tube with a reservoir at the end. And normally this is collapsed like so, and the desire of the bulb to expand is what generates negative pressure and sucks the fluid into this little reservoir, and this is what you're emptying. And really emptying just means taking the cap off and pouring out the amount and recording the amount. While the drains are in place, they usually don't require much care other than emptying the drains in my practice twice a day. And my patients are given instructions on how to record the output, because again, it is that amount which is used to determine how long the drains stay in. There's also much discussion about stripping the drains. The stripping is done so that little clots like this do not cause the clogging of the tubing and prevent fluid from coming out. So there are many different ways to do it. I find that the easiest method is place one hand near the body so that you don't accidentally pull out the drain. Usually take a pencil or a pen, put it on, lay it on top of your palm. And what I usually do is place the pen or pencil on top of my index finger right under the drain, and then clamp it on top with my thumb. And then all I do is just pull it back and see how that it clears the tubing of the clot. And so you just pull it back slowly. And again, you just move your hand back each time so that you're pushing this clot into the tube without actually accidentally pulling out the drain. So you can see that the clot, even without the suction, it will happen much more rapidly with the suction, but even without the suction, doing this maneuver will push the clot into the reservoir. And that's what a stripping is. Again, I'm not sure that it's something that has to be done routinely. I think once it gets clogged up, it can be done maybe every once in a while would be fine. The other issue that I wanted to go over was there are different types of drains. I know that some of the patients have had drains before and remember how bad things were, but my drains are usually in very short distance, so the removal is very simple. The other key part is on my drains, the inside part is just as wide as the outside part, and that's important because it just slides right out, whereas most conventional drains are much wider on the inside, so that when you try to pull it out, the opening has to dilate for the inside part to come out, and that's what's so painful. So my drain removals are, because they're short, same diameter, it's very easy, quick, and